Guess what? Grandma's back in rehab. Why, you ask? Well, because of, heart failure. So you ever wonder what heart failure is? Kind of what it does to you and, symptoms and all the things? Well, let's ponder that, shall we? Before I start blabbing on about heart failure and all the bad things it can do to you, a couple general things. One is I am a medical doctor. I've been practicing hospital-based medicine now for over 20 years. I am board certified in internal medicine, and everything that we're going to talk about is mostly educational. It's to, talk about concepts and kind of what it is and what it means. This is not medical advice. But if you have any issues, questions, or anything like that, please, go to your doctor, get checked out, and, enjoy. Welcome back to Grandma Needs Rehab. And in this episode, we get to talk about heart failure. So what exactly is heart failure? If you said it's when your heart fails, you'd be mostly right, although that would be a very short video. So if you wanted a definition of what heart failure actually is, I got one for you. So that's the technical definition for heart failure. Symptoms from a structural or functional cardiac disorder that impairs the ventricle from filling or ejecting blood. Bored the crap out of me. As a matter of fact, I fell asleep twice writing it down. But technically, that's the definition for what heart failure is. For most of us, that means nothing. So what does it mean for grandma? Like, what actually is heart failure in normal people terms? So what heart failure means to normal people is that fluid gets backed up because your heart's not squeezing or your heart's not relaxing and filling up with blood appropriately. Okay? What does that cause? Well, it causes blood flow to back up into places it's not supposed to be, like your lungs. So most people with heart failure have shortness of breath and often have low oxygen levels. Well, how does that work? By definition, heart failure is one of two things. It's usually when the heart is not squeezing and ejecting blood forward, or it's not relaxing and filling up with blood appropriately. And because of that, blood gets backed up. Well, where does it get backed up? Well, we'll talk about that in a second. But when we talk about things not moving forward or ejecting, or things getting backed up because they're not filling up, how does that work? Like, what does that mean? Well, when things get backed up, they get backed up. So let's take anything like an escalator, okay? So if you have an escalator, you're going on vacation, and you got to get from down here to up there, okay? So let's suppose this escalator is not working right. I don't know why, because I don't know how they work. But let's suppose there's something wrong, like one of the motors or belts or whatever they use to, make it move forward. Let's suppose it's not working right. So the escalator is still moving up, but it's just not moving as fast as it's supposed to. It's not moving people forward the way it's supposed to. What happens? People get backed up. So people can still get on here. They can still move. They're just moving slower than they're supposed to. Just angry people. So the opposite is also true, where this thing may be working fine, but there's a problem down here. Let's suppose, I don't know, there's a sign. And the sign says, wet floor, because someone, spilled a slushie or something. And no one wants to step on a slushie. So those people kind of get backed up. They get backed up not because this escalator's not working, not because it's not taking people up as fast as it normally would. It's because there's something here that's preventing people from getting on. So two different problems, both end with a bunch of angry people back there, like my vacation. In one instance, it's not pushing things forward the way it's supposed to because it's broke. And in the other situation, something is holding it back or preventing things from getting into it, getting onto it, and going up. Your heart's the same way. One time, or one instance, your heart's not squeezing the way it's supposed to, and it's not projecting things forward because it's kind of broke. There's something wrong with it that's preventing it from squeezing. The other situation is when your heart is squeezing fine, but it's not relaxing well enough. Things are having trouble getting in. Blood is having trouble getting into your heart to be ejected forward. We have two major issues associated with your heart that can cause heart failure. One of them is trouble squeezing, or systolic. That's when your heart's not squeezing as well as it's supposed to. It's a systolic dysfunction. Trouble squeezing, systolic. There'll be no quiz at the end. You don't have to remember any of this. The other one is diastolic, for those that are interested. And diastolic is when your heart relaxes. So if you have a problem with it squeezing, you're having a problem with systolic function. If you're having problems with things relaxing and filling up with blood, that's diastolic. Yeah, in case you hear it floating around the hospital or cafeteria or something. Now, does grandma give a crap what those words mean at 3 o'clock in the morning on a Saturday when she can't breathe? No, she doesn't. But both of those things can cause fluid to build up in her lungs, causing shortness of breath, causing low oxygen levels. And yeah, she does care about that. So heart failure is when fluid gets backed up into your lungs because your heart's either not squeezing good enough or your heart is not relaxing and allowing the blood to get in there fast enough. So fluid backs up into your lungs, and how does that work? Well, in your lungs, you have what we call air sacs. And I know I can't draw, but that is supposed to be an air sac. And what an air sac is kind of what it sounds like, where in the bottom of your lungs, that's where the air goes to as you inhale. Air goes down into those air sacs. And at the bottom of these air sacs, kind of surrounding them, is blood vessels. And the oxygen from these air sacs dissolves into these blood vessels, kind of gets sucked in there, and that's how your body gets oxygen. Well, when you have heart failure, fluid backs up. And where does it back up to? It backs up to these blood vessels. So these blood vessels get real thick, and not in a good way, thick, but thick, because they're so full of blood. Now, your blood vessels kind of look, well, actually, they probably look nothing like that, but you'll have to pretend that's a blood vessel, okay? Inside your blood vessel, you have red blood cells. And if anybody's seen any of my other videos, I pretty much always look like eyeballs for some reason, but they're red blood cells. And these red blood cells are floating through your blood vessels, and in with your red blood cells are other things like platelets and white blood cells, and predominantly plasma, which is basically like a fluid. It's kind of like the water portion floating around in your blood. Well, when the pressure gets really high inside these blood vessels, sometimes that fluid can kind of leak out, and it leaks out that way and down that way. Now, your red blood cells, because they're so big, they tend not to squeeze out through these little holes, but the fluid does. And where does the fluid go? Well, if the fluid is in these blood vessels and it starts leaking, it can leak out into these air sacs. And these air sacs start to fill up with fluid. And because they're filling up with fluid, the oxygen that's going down into those air sacs has trouble getting from the air sac through the fluid into your blood vessels. A nice way of saying you don't get the oxygen that you're supposed to. It can't get through all that watery stuff. Now, in the hospital, some people also talk about things like pulmonary edema. Well, what is pulmonary edema? It's pretty much what we were just talking about, where fluid backs up into the lungs and oxygen has trouble getting through that fluid into your blood vessels. So what's the difference between heart failure and pulmonary edema? Well, both of them can be on a chest x-ray. They can look very similar. As a matter of fact, you can't really tell the difference between pulmonary edema and heart failure on a chest x-ray because it's essentially the same thing. What makes it different is that pulmonary edema is a term that we use for people that have fluid in their lungs for other reasons. For example, heart failure is fluid in your lungs because of, well, your heart failed in some way. Either it's failing to squeeze forward well enough and things get backed up, or it's failing to relax enough and blood is having trouble getting in there and it backs up. It's failing. Your heart failed in some way and you got fluid in your lungs. Pulmonary edema can be fluid in your lungs, which is essentially the same type of thing, but it can come from other stuff besides your heart. Okay, for example, people that smoke stuff, like substances, recreational kind. Some of those can, well, let's just say not some of them. They're really not good for the whole lungs in general, but they can cause irritation and toxicity. In other words, they can damage the lining of your lungs. Those little air sacs, the things, okay? They can damage the lining of those and they can actually start to leak fluid. So they're leaking fluid just like with heart failure, but it's not caused from your heart. So it's pulmonary edema. People that firefighters and stuff like that, they, doing the firefighting thing, saving people, they can inhale stuff. And unfortunately, that stuff can be very toxic to your lungs, obviously, and you can get damage to your lungs, hence pulmonary edema. It looks the same. We treat it a little bit differently though, because it's a different type of irritation to the lung. Sometimes people can get pulmonary edema because of kidney problems. For example, people that are on dialysis. Unfortunately, in the hospital, we see people on dialysis. Sometimes people come to the emergency room because they didn't go to dialysis. They missed dialysis. They had trouble getting to dialysis. For whatever reason, sometimes the fluid can back up because they missed dialysis. What does dialysis do? Well, for most people that have kidney problems, dialysis, in addition to getting rid of poisons and such, it takes off extra fluid that your kidneys normally would pee off. But people with kidney damage, they don't so much do that all the time. So if you end up missing dialysis, or for even people that are on dialysis scheduled, sometimes they can get extra fluid, and that fluid doesn't have anywhere to go because their kidneys aren't working, so it can build up, and it can build up in the lungs. That's pulmonary edema. It's different because they don't have fluid in their lungs because their heart failed. They had fluid in their lungs because of a different reason. So heart failure and pulmonary edema, even though people kind of, interchange the two, can actually be quite different. For all those keeping score, we do have a bunch of different things that can lead to problems with heart failure from the squeezing side and from the relaxing side. And the reason that we put all these down, and granted there's a lot more than this, but these are kind of some of the more common ones that we see in the hospital. The reason we do that is because it helps us decide, hey, how are we going to treat them? Do we need to treat them this way or that way based on what the problem is? For example, tachycardia. Sometimes people can have arrhythms or cardiac arrhythmias that cause their heart rate to go too fast. And over a period of time, your heart has trouble relaxing, because if you think about your heart beating 70 times a minute, normal. So squeezes, relaxes, blood fills up, squeezes, relaxes, blood fills up, squeezes, relaxes, just keep doing that. That's normal. But when your heart is going 120 or 130 times a minute, your heart is going really fast. It's squeezing fine, but now you have trouble relaxing. It's not filling up with blood. So we might want to treat that a little bit differently than somebody that has CAD, which is coronary artery disease, okay? So if you have a blockage in your heart and that's preventing your heart from squeezing, not relaxing, we treat that very differently than somebody that has an elevated heart rate and we need to slow it down, okay? Now, sometimes the treatments are similar, okay? But there's so many different things that can cause these that there's no way we could go over them in one video. And at the same time, the treatment for them obviously, would be multiple videos, which, yeah, boring. But the main ones that we see as far as squeezing, okay? Coronary artery disease, probably one of the most common. That means you have a heart attack, or you're having a heart attack, or you had a heart attack and now there's damage to your heart and your heart doesn't squeeze the way it's supposed to. You come to the emergency room, you're having chest pain, we do an EKG, it looks like you're having a heart attack. Can you go into heart failure because of that? And the answer is absolutely. If you had a previous heart attack, can you go into heart failure because there's damage to your heart and it doesn't squeeze the way it's supposed to anymore? And the answer is unfortunately yes. That heart attack could have happened years ago and you're still having problems with it because your heart is damaged and it's just not squeezing efficiently, okay? Myocarditis, basically that's an inflammation of the heart muscle. Usually after like a virus, flu, COVID, things like that. Lots of different viruses can cause irritation to the actual heart muscle. And when the heart muscle is irritated, it doesn't squeeze properly. If you can think of the flu and what it does to your muscles, if the muscle aches and stuff like that, there's inflammation of your muscles, it can happen to your heart too. We call it myocarditis because we got to have big fancy names for stuff, but that's essentially what that is. And of course, inflammation of your heart because of a virus or something like that, we treat that very differently than we do for people that have an elevated heart rate, okay? Or just high blood pressure. Now, certain medicines can cause heart failure, which there's, not a lot, but way more than what would fit in this video and keep people awake. But things like chemotherapies and stuff like that, not all chemotherapies, but there are some that can potentially cause problems with your heart. Does that mean they do? Does that mean even if your chemotherapy could potentially cause that you're going to have that? No. But some medications can lead to problems with your heart squeezing sometimes. Tachycardia. So we already talked about how you can't relax when your heart is going really, really fast. Well, over a period of time, your heart rate can go so fast and it can go like that for so long that your heart basically gets tired out and then it starts having trouble squeezing because it's just tired, like me. But if we can control the heart rate and get it to slow down, a lot of times your heart rate or your heart will start squeezing again. Hypertension. Hypertension can also cause problems with squeezing. It can cause problems with relaxing and it can cause problems with squeezing. Well, how does that work? Well, if your heart is normally that size, it's not actually, it's a little bit bigger and looks better than that. But if your heart is normally that size and you have high blood pressure and you don't get it treated over a period of time, eventually that heart can get really thick and not in a good way. The problem with the heart being thick is that as it gets thicker and thicker, the hole or the area that your blood can fill up gets smaller and smaller. So that's how it prevents your heart from filling up with enough blood. It's because it gets thicker and thicker. Why does that happen? Well, it's a muscle. So if you pumping weights for a long period of time, your muscle gets bigger and bigger and bigger. Your heart's the same way. It just gets bigger and bigger and bigger. And as it gets bigger and bigger, the hole inside that carries the blood gets smaller and smaller. Has trouble relaxing and filling up. Stuff gets backed up. Now, if you let that go on for, a long time, over a long period of time, your heart gets then stretched out. And not in a good way. And now, because your heart's stretched out because it's so tired from doing that for so long, it can fill up with lots of blood, plenty of blood to get in there, but now it's not squeezing very well. And it's not squeezing very well because it's been dealing with high blood pressure for 20 years. So high blood pressure can cause trouble relaxing and filling up when it gets too thick. And then it can cause problems squeezing when it gets, tired. Takotsubo cardiomyopathy, big fancy term that I had to look up so I didn't spell it wrong. But Takotsubo's cardiomyopathy is another interesting one that people, let's just say that not used to hearing that term Takotsubo, but it used to be called broken heart syndrome, where people would have a horrible stress in their life. Could be the death of a family, divorce, just family stressors, all sorts of just not good stuff. And it can cause so much stress on a person that it can actually affect how the heart squeezes. And we can see that on an ultrasound. And that's often involved with the squeezing of the heart. Luckily, with the right medications and stuff like that, it does tend to get better. In the big picture, when grandma comes into the emergency room at 3 a.m. because she can't breathe, does she care about all the other stuff we just talked about? Nah. She just wants to breathe. And she doesn't know why she can't breathe. She just wants to breathe. So what are the symptoms that bring people to the emergency room, or the doctor, or the primary care office, or whatever the case may be? Well, there's a bunch of them. I just put some of the major ones because these are normally what we see. Now, if you ask Google, I'm sure they'll have a bunch of other ones, but these are the major ones that we see when people come to get treated. The first one is actually shortness of breath. I didn't put that first. I don't know why. I'm just tired. But shortness of breath is actually the one that we see the most. That's what drives people to the emergency room. You don't always have to have shortness of breath like continuous. In other words, you could have shortness of breath going up and down stairs, something that's different, something that's, I feel more short-winded than normal. A lot of times when people have a decent amount of heart failure, they're struggling. They're struggling to breathe, just like having conversations. So they come in really, really short of breath, and then we check this thing, which is hypoxia. Hypoxia is a nice way of saying that their oxygen levels are low. So, they come into the emergency room, stick a thing on their finger, they're really short-winded, their oxygen level is usually less than 92 or 90 or below. And then, you could have heart failure. Some of the other things that can cause that, or some of the other things that we see when people come in, edema. So you have swelling of the legs, which is what edema is. Now, it doesn't have to be just of the legs. Your feet can be swollen, your legs can be swollen, your hands can be swollen. Like when that fluid gets backed up and it gets backed up into your lungs, it gets backed up everywhere, okay? So we can have literally fluid everywhere. Now, most commonly because of gravity, just kind of sucked down because of gravity, most of the time, feet, legs, they're the most common. But if heart failure happens quickly, it can back up other places first. For example, some people, when they get heart failure very, very quickly, they can develop bloating of their stomach and things like that, because the swelling, the fluid that backs up is backing up in their belly before it hits their legs and their feet. So regardless of what Google says, you don't have to have edema in your feet or your legs to have heart failure. Okay, it is true that it is common to have that. That doesn't mean you have to. So some people that don't like to walk or stand up or stuff like that, then you can get fluid elsewhere. For example, people that lay in bed a lot, like my son, they can get fluid in their butt because that's where gravity pulls it. So edema doesn't have to be of the legs, could be of lots of different places. Shortness of breath, not breathing very well. Hypoxia is low oxygen levels. And of course, not all people get chest pain, but heart failure can cause chest pain. And ironically, chest pain can also cause heart failure. So before, when we talked about the heart not squeezing well because of coronary artery disease or CAD, if you have low blood flow to your heart and it's not squeezing very well, you can get chest pain because you're having a heart attack. Or you could have low blood flow to your heart, which is like angina, which is low blood flow to your heart. And your heart's not squeezing well because it's not getting enough blood. That can cause chest pain, even if you're not having a heart attack at that time. But that chest pain, because you're not squeezing well, things get backed up, then you have heart failure. Well, heart failure can also cause chest pain in the sense that if you have fluid in your lungs and oxygen is having trouble getting through the air sacs, your oxygen levels could be low. That's what hypoxia is. Well, when your oxygen levels are low, that means your muscles aren't getting the oxygen it needs, which, heart's a muscle and it needs oxygen too. So if your oxygen levels are low and your heart gets less oxygen than it's supposed to, you get chest pain. So chest pain can cause heart failure. Heart failure can cause chest pain. By no means are these all of the symptoms that you can get from heart failure, but these are the ones that most commonly we see. These are the ones that most commonly bring people to the emergency room to get checked, regardless of what Google says. We know what heart failure is. We know what heart failure can kind of do to you, or how it makes you feel, what it does to make you come to the emergency room. So then the issue is, well, how do we find it? Well, grandma, what's the first thing we did? Well, we normally do an EKG. It's probably the first thing we do. And what that looks for is abnormalities in the little heart electricity that would make us think that she's either having a heart attack or she has low blood flow to her heart. In other words, her heart is stressed out, maybe because of a blockage, which is the coronary artery disease, okay? We need to make sure if she's having a heart attack or something like that, that we go ahead and take care of that in addition to the heart failure. And for those that are interested, saw my video on coronary artery disease and heart attacks, they'll kind of explain a little bit more about that in detail. But EKG, probably the first thing we do. Second thing we do, chest x-ray. And we write that because we're lazy. We meaning me. Other people, yeah, but chest x-ray. And the reason we do a chest x-ray is when that fluid builds up, you can actually see the fluid on the chest x-ray kind of, spreading out into the air sacs. Like we can actually see it on a chest x-ray. And then hey, you got a heart failure. Don't always smile about it, but nevertheless, chest x-ray. So EKG first, just to make sure that everything with the heart is okay. Chest x-ray usually confirms that there's fluid there. And then we get admitted to the hospital. And while we're in the hospital, we do a bunch of other stuff, okay? Some of the other things we can do an echo. Echocardiogram is an ultrasound of the heart, kind of like the baby ultrasound, but higher up. And what it does is it looks for how the heart is functioning. So the echo is probably one of the most important things that we do when we're looking at heart failure. Why is an echo so important when you have heart failure? Well, I'm glad you asked. Because an echo is the thing that helps us usually determine whether or not there's a problem squeezing or a problem relaxing, whether it's systolic or trouble relaxing is diastolic. So the echo will allow us to see a couple things. Wall motion, which actually helps us see how the heart is squeezing. It'll tell us whether the wall of your heart is squeezing appropriately. If there's a problem with wall motion, that usually means there's a problem with the squeezing or systole. Now that could be because you had an old heart attack. That could be because you're having a heart attack now. But obviously that would be kind of important. But wall motion really helps us determine whether or not there's a problem with the squeezing of the heart, okay? It can tell us thickness. If your heart is really thick, like we talked about, high blood pressure for years and years and years, your heart gets thicker and thicker. It can actually help us see that. So you can see that your heart is thicker than usual, and it tells us that your heart is having trouble relaxing, like me. And that also will help change kind of how we, treat somebody. It'll show your heart valves. Now that's kind of important because your heart's got a bunch of valves, okay? They're like doors, open and close, open and close. If there's a problem with those doors opening and closing, that can cause a problem with fluid building up. For example, if the valves are broken and they're just kind of, flopping, the fluid can go right past them and back into your lungs because your valves are not closing properly. The other issue is if your valves are too stiff and they don't open properly, it can prevent blood from ejecting, which is, squeezing. So the valves and making sure that your valves are okay are very, very important. We can also see that on an echo. And then we can see something called an ejection fraction. Now, an ejection fraction is basically how much your heart squeezes, or let's put it, it's how much blood gets pumped out of your heart every time your heart squeezes. And an interesting way of thinking about that is your heart does not eject all of the blood in it at one particular beat. To better explain that, that means when your heart relaxes, blood fills up, then your heart squeezes. The blood that was in there, when your heart squeezes, it doesn't pump 100% of that blood at one time. It normally ejects about 60%, more or less, in a normal heart. That means when your heart relaxes, it fills up, and out of all the blood that is sitting in your heart, when it squeezes, about 60% of it gets ejected at one time. Now, why is that? Well, why don't we eject 100%. I want 100%. Who doesn't? Well, it's not very efficient, because when I'm sitting here talking to people, or they're talking or watching TV or whatever the case may be, your heart doesn't need to eject 100% of the blood that's in it at one time. Okay? You don't need all of that to work properly. So if you're out and about, let's suppose you're at an ATM machine and somebody comes up and they're like, give me your money, like a knife thingy. So now, all of a sudden, instead of ejecting 60% of your blood, your body sends out all these responses and signals and stuff like that that says we need blood and we need it fast. In other words, your body goes into this mode where all of a sudden your heart has to start pumping really, really hard and really, really fast to try and get as much blood to your muscles as you can, so you can either run away or fight or, do magic, whatever happens to be your thing at that time. And your heart can do it. Your heart has extra. It's got reserve in there. So now, if you're at an ATM machine and someone scares the crap out of you, now instead of ejecting 60%, now you're ejecting 100%. And you have all that reserve to do whatever you got to do. Okay? So, but the echo, the ultrasound, will tell us what the ejection fraction is. Okay? Now that's important, because if grandma's ejection fraction is supposed to be 60%, and now her ejection fraction is 20%, that tells us that her heart is not squeezing right. And we need to figure out why. Even if there's no wall motion abnormality, even if her heart's not too thick, even if her valves look okay, something is causing her heart not to squeeze properly. And we can see all of that on an echo. So we talked about heart failure. We talked about what it is. We talked about the squeezing. We talked about the relaxing. We talked about the blood flow and how it backs up into the lungs, as well as, like other parts of you. We talked about how you'd find heart failure besides the x-rays, the chest x-ray, the EKG, the echoes, and things like that. And there's other things that we do as well, but those are kind of the main things when we look at heart failure. So then begins the question, does grandma care about all that? And the answer is, nah, she still can't breathe. So why is it that when she comes into the emergency room, we worry about all this stuff? Well, it does affect treatment while she's in the hospital, but when she's in the emergency room and we got to get grandma breathing better, we do a couple things. The first one we do, obviously, is we put people on oxygen. Okay, oxygen. If your oxygen levels are low and you're a heart failure, the oxygen gives your body a little boost of oxygen that it needs, that it's having trouble getting, because you're having trouble getting oxygen through those air sacs. And for those that are interested, yes, the oxygen that you breathe in still has to go down to those same air sacs. It's just, if you have air sacs with fluid in them, and we start pumping your lungs with extra oxygen, some of that extra oxygen is going to manage to get into your bloodstream, and your oxygen levels usually do get better. But that doesn't fix the fluid. How do we fix the fluid? Well, usually we put people on something called a diuretic. And a diuretic is, a lot of people call them heart pills, but in the hospital, obviously, we don't use the pills so much. We use diuretics via IV, which is basically a medicine that makes you pee. And what it does is it makes you pee off all that excess fluid that you have. So these blood vessels that were back here that were real thick, if we can get you to pee off some of that excess fluid, then some of the fluid from your lungs can get reabsorbed into those blood vessels, and we can lessen the amount of fluid in your lungs. Basically, we make grandma breathe better. That she does care about. So diuretics to make you pee off, oxygen to make you breathe better, okay? Now, there's lots of different treatments for the different types of heart failure. So, I mean, that in itself could be multiple videos, which, not to bore people to death, but yeah, those are the two things that we primarily start with. And then we start looking at the echo, and then we look at, okay, how's the heart squeezing? How's the heart relaxing? And do we need to do other things? Do we need to look at things for heart attacks? Do we need to look at things for when your heart's going too fast? Do we need to look at things for blood pressure? All of those treatments can be different based on what your echo shows, what you present as, and some of your other medical problems. So you'll just have to trust me on that. But the mainstay for heart failure is to get rid of fluid, get your oxygen levels up, and control some of the things that we talked about earlier between the high blood pressure, coronary arteries. Control those things, make them better so the heart failure gets better and ideally doesn't come back. Now, some of the things we didn't talk about are, what if you can't take a diuretic? What if your kidneys don't work? What if you need dialysis to remove fluid? Those are all other questions that are very good, and unfortunately, again, could be entire videos on how to deal with those specifically. What's important is that you get treated individually based on what you have. That's why we do all this stuff, so we can figure out what's wrong with grandma. Why are we treating grandma this way and that way and this way, where grandpa Jack used dialysis and something else? Well, it's because he had a very different problem. He had a very different issue, and we had to deal with other things with grandpa Jack, okay? Each person is different, and thereby telling one person that this is the treatment for heart failure is not fair, because, many people will have, out of 10 different people that have heart failure, you may get 10 different treatments. So that's the end of my show. Hopefully we've learned a little bit about heart failure and kind of why grandma couldn't breathe so good. Hopefully we've also learned a little bit about, peeing off some of that excess fluid and why we do what we do, and that everybody's a little bit different when it comes to, figuring out where the heart failure is coming from. And thereby everybody has kind of a different treatment. But for those that are worried, grandma's doing fine. Still a little puffy. Still trying to get some of that fluid off, but she's in rehab, getting a little bit stronger. By the time her cankles are all gone, we should hopefully have another video. So if you like this kind of content where we sit and talk about medical stuff and kind of the, process of whatever, like, subscribe, do all the things, and then hopefully by the time she gets home, I'll get another video to you.